Good morning, everybody. Dr. Patmos. It is May the 1st, 2026, and starting off the month with an important video for you. So, today's New York Times has a very nice article about Dr. Sara Brenner at the FDA and her new role. She was just appointed by Donald Trump as Robert Kennedy's senior counselor for public health. And it was a very nice article written in the New York Times and described her credentials, largely taken from her FDA bio. Um, the article described her as being a very highly qualified physician. So, however, as we know, throughout the Trump administration, there have been many examples of highly qualified physicians who, when you actually start to dig into their resume and their CV, you come up with stuff that doesn't quite add up, seems a little bit off, or in some cases has been outright fabricated and embellished. We know, I have shown and demonstrated that several of the physicians in the Trump administration have grossly embellished CVs, including some with even fabricated content that cannot be corroborated or validated or verified at all. So I think it's very important and appropriate to be skeptical of all of Trump's physician appointees. We should be skeptical of all physician appointees in the federal government, and they should all be thoroughly, completely, and formally and professionally fact checked, have primary source verification, background checks, and their resumes need to be vetted line by line, claim by claim for accuracy. Because we know there's about 50% of all resumes contain some false, embellished, exaggerated, fabricated content. So we know that that's a big problem, all not just in medicine, but all over. It's actually less of a problem in medicine than in some other fields. But roughly about one in out of every two resumes have some stuff on it that's not quite honest. So I thought I would do a deep dive into Dr. Sara Brenner's background, and what's below in the text is the result of this analysis. I really dug pretty deep, and it's quite interesting. The first observation that you can make is that she does not have anywhere that I can find a publicly available CV. That's a red flag. Your CV is from Latin is the record of your life. And if for a physician, especially a physician with a public role, you would expect that their CV would be available uh, online and easily retrievable. I cannot find a CV anywhere. All I can find are statements that have been made and bios that have been put out there that reference certain credentials and degrees. And so I've tried to fact check these claims. And indeed, this Dr. Brenner does have a lot of very bona fide real credentials. She is an MD. She claims to have completed an internal medicine residency and also a residency in preventative medicine. But curiously, there's no evidence that she is board certified by the American Board of Medical Specialties. Now, I find that very odd why someone would complete a residency in internal medicine but not go one step further and take the test and become board certified. I don't understand that. And why would you do a residency in preventative medicine and then not take the test and become board certified? That is very, very odd to me. I have a hard time wrapping my brain around why someone would actually finish a residency but not become board certified. It's kind of like not finishing the job. It's like hitting a home run and running around the bases, but then after you past third base, you just head for the dugout and don't bother stepping on home plate. It just something is off when a physician doesn't get board certified and they're board eligible. So I think that was peculiar. Secondly, her her rise up the academic ranks at the State University of New York is very unusual. If the timeline is correct, this doctor went from being a resident physician to being a faculty member to being what she claims was a tenured professor, tenured faculty member in just a few years. That would be really unusual. It takes quite a long time to go from assistant to associate to full professor and then get tenure. I've never seen that happen in just a couple of years. That's a little bit odd. Another thing that is hard to wrap your brain around. And if you go to the SUNY website, there's no listing of her as a tenured faculty member. So now they may not have faculty rosters, not all universities do, but it's hard to independently corroborate her claim that she held these faculty appointments, assistant, associate, full tenured professor, in just a couple of years, um, finishing her residency and not being board certified. It's just a little bit odd. And then there's the actual research um, productivity. She's got about 20 papers, most of which she is not the lead author on, but she's part of a group of people. And these articles all pretty much deal with the same area of expertise. So she has a documented track record of publication, not huge, 20 to 25 papers or so, not huge, but there's evidence there of academic productivity. And there is at least one independent grant that I can confirm that she has gotten to fund her research. But it's not certainly a deep resume with hundreds of publications and many grants and funded research projects. It's very scanty in that regard. And then the other thing that's important is looking at what her area of expertise is. She has a very narrow niche area of expertise. Her expertise is in imaging, spectral analysis, imaging of nanoparticles. That's what she is trained in, and that's what her career has been all about. Basically, what she does is she has developed this use of imaging to find little tiny little nanoparticles and where they go. Um, it's important. She has no background other than internal medicine residency, non-board certified, in infectious diseases. She's not an infectious disease doctor. She's not a microbiologist. She's not an immunologist. She's not a clinically active physician. From what I can tell, she's never actually practiced medicine, seen patients at the bedside, taken care of sick people. She's not an expert in infection control or epidemiology. She doesn't have any background in vaccine development, vaccine research, etc. She is an expert at spectral analysis and imaging of nanoparticles. That's what she does. Now, that's very impressive. It's a whole new field of medicine, and I think it's important. We need to understand nanomedicine and nanoparticles and so forth. But that doesn't qualify her in any way, shape, or form as an expert in vaccines. And we know with her role with Robert Kennedy that she's going to be involved in his because he's all about discouraging vaccines, and she has apparently been vocal about vaccines, stating that she's a proud Maha mom and that she did not vaccinate her children. So she apparently is an anti-vaxxer, and she's an anti-vaxxer with a very impressive bio of claims on the FDA website, but no CV and no board certification and no clinical experience and no actual training in infectious diseases and no actual training having anything to do with vaccines. So it's a fascinating thing. She may be, she's obviously a very legitimate um, physician, and she's licensed in the state of Maryland. And that's interesting that she has a license to practice medicine, considering that she has never practiced medicine. I don't know how you get a license to practice medicine and maintain it, and if you have no clinical activity. I have 14 medical licenses, 14 different states, and you have to demonstrate ongoing clinical activity to maintain an MD license in all the states I'm at. I don't know how you can get a license to practice medicine and hold a license to practice medicine if you've never practiced medicine. Well, anyhow, there are a lot of things about Dr. Sara Brenner's credentials that I think are interesting, that deserve further investigation. There's just some oddities, some peculiarities here. It's hard for me to wrap my brain around no board certification, such a rapid rise in faculty rank with no objective evidence that on the SUNY website that she actually was a tenured faculty member. And if you are a tenured faculty member, why would you give that up? That's a lifetime position. I mean, who you can't get fired when you're a tenured faculty member. Why would you give that up? And her role at FDA is unclear to me. But one thing that is very clear, she's not an expert on vaccines. So she should not be opining in any way, shape, or form about vaccines or infectious diseases, because she is not trained in those areas. So I hope you found that interesting, and hopefully um investigative journalists will begin digging a little deeper into the actual credentials and corroborating and verifying credentials. That's what we need to do. We need to corroborate, verify, fact check, do primary source verification of all these physicians who are working in the federal government to be sure that they are what they claim to be.